On day one, no one you know is sick. It feels like a normal day. It may stay like this for a long, long time until one day a few people you know are sick. And suddenly, a few days later, you're going to see everyone is sick. And it will feel like it happens so instantly. Everything looks fine until it isn't. This is the paradox of pandemics. And this is why an outbreak like coronavirus disease 19 or COVID-19 is bigger than it seems it is. You'll hear health officials calling for huge, drastic, and rapid responses in early days when the infection numbers are relatively small. Some people will tell you these actions are overreactions. Sports teams will not be playing at all, huge gatherings and festivals will be cancelled, schools will close and so will offices, on field operations are going to completely shut down, the government will tell you to avoid personal contact, media sensationalism. All too much for something that isn't even as big yet. But this way of thinking fails to appreciate how disease outbreaks work. It was never really fine to begin with, but we don't notice until it's very, very late. Hi all, I welcome you to this machine learning session on the spread of COVID-19. In this session, we are going to be building a machine learning model using Python to discuss the spread of the coronavirus as well as certain steps taken by governments of countries such as India, China, South Korea, and Italy. It is all in theory. We are not claiming the accuracy of the entire model or what we are saying. We are just going to discuss about the inferences we can draw through the numbers, through the data that we have acquired. Before we begin, let's discuss our agenda for today. We're going to start out by introducing you a little bit to the spread of the coronavirus disease of 2019. Then we're going to move on straight to our Colab notebook, and we are going to execute an entire machine learning model discussing the outbreak, its impact on different countries, where does India stand in this outbreak, and finally discuss a few solutions. With that, we come to the end of our agenda. Now, the main objective of this particular video is to step into the shoes of a data scientist for an hour or two and understand how will they approach all this ever expanding scope of data that we are being exposed to. Now, as a data scientist, there are two parts of your job. One of them entails you getting your hands dirty, being aware of your surroundings, being aware of where your data is coming from. And the other part is the jazzy part of your job, not so dirty part of your job. And this is what people think about a data scientist when they say that the job of a data scientist is the sexiest job of the 21st century. Now, when something like the COVID-19 or the coronavirus is on the spread, it basically goes through 4 stages. First is the import stage of the disease, followed by the contact stage of the disease, which is where the disease starts to spread. Stage 3 is a community transmission. And finally, the entire thing is declared as a pandemic. And this is how a pandemic progresses from an import to a global pandemic. So basically, what I'm trying to say is the outbreak of coronavirus is obviously developing into a major international crisis. And it's lending to influence the most important aspects of our daily lives. For example, in most of the major cities in India, places where community gatherings occur have been shut down, like malls, cinema theaters, pubs, so on and so forth. Apart from that, in immensely affected areas, at least in most urban cities, including mine, people are starting to stock up on essentials because of the complete shutdown. Grocery shops are open for a limited number of hours a day. For example, I have stocked up for an entire month. I know people who have stocked up for 2 or 3 months. And finally, the travel ban. India has banned global travel of Indians. Corporate travel has been immensely reduced and flight fares hence have dropped. On the 22nd of March, India reported its 4th death with 325 total confirmed cases due to COVID-19. A few fresh cases from certain states such as Gujarat, Madhya Pradesh, West Bengal, and Odisha, and had been reported by the Union Ministry of Health and Family Welfare. Now, the objective of this case study is to come up with a strong machine learning model which predicts how the virus could spread across different countries and regions. The goal of this task is to come up with something that predicts the spread of the virus in the next week. So let's move on with our model. So this is what the model looks like. It has been written in Jupyter and it's been executed using Colab. All of the data sets that I'm using, I'm going to leave in the description box below so you can access it whenever you want. So here is our problem statement. Let me read this out quickly. Now it's the 25th of March and India has reported its 9th death with 562 total confirmed cases due to COVID-19. Fresh cases from Manipur, Bihar, Gujarat, and Madhya Pradesh have been reported by the Union Ministry of Health and Family Welfare. As the coronavirus outbreak continues to spread in this country, the question that we are all trying to answer is that will India be able to tackle this pandemic, or are we going to witness another case like Italy, South Korea, or Wuhan? Now, the objective here is to come up with a really strong model that predicts how the virus could spread across different countries and regions, and the goal of this task is to predict the spread of the virus in the next 7 days. Now, this objective has been broken down into certain tasks, the first of which is to analyze the present condition in India. As I had already mentioned, India is on the stage 2 of this pandemic progression, which is why the shutdown was important. Second, we have to find out similarities and differences between the trend in India and the trends during the same stages in Italy, South Korea, and Wuhan. We also have to explore worldwide data and keep ourselves updated. The data sets we have today are updated up to the 25th of March, which is 3 days old. And finally, we have to forecast the worldwide coronavirus disease of 2019 cases using Profit. Now to begin, we are going to be importing a few required libraries. The first one is Pandas, which is the library that we need if we are working with tabular datasets. Obviously, as you can see on the left, all our datasets are either Excel files or CSV files, which are all forms of tabular spreadsheets. Hence, we need Pandas to manipulate and analyze such data. Apart from that, we are also going to be importing certain visualization libraries. We have Matplotlib, which is the most basic visualization library. And apart from that, we have Seaborn, which is slightly more advanced, and Plotly, which is the most advanced of them all. And Folium, which helps us populate maps and geographical data. Now, some of you might wonder, what is this inline command? Let me tell you, this is nothing but a command which instructs Python to not produce your visualizations in a separate window, but to do it in the same window. All of these libraries are originally there in your ROM. By importing all of these, you're basically instructing your system to import these libraries to your RAM. Next, we are manipulating the default plot size of your visualizations and finally disabling a few warnings. Now I can go ahead to runtime and run all of these cells together by using the run all option or simultaneously pressing on Control and F9. But because I have to explain to you along the way, I'm going to run this model cell by cell. So I'm just going to run the current cell, which will give the instruction to the Python interpreter to run this single cell. With that, let's move on to part 1, which is analyzing the present condition in India. This has 19 cells hidden. We'll just click on that. Now here's just some data about how COVID-19 was reported in India. The first case was actually reported on the 30th of January when a student arrived in Kerala from Wuhan. We got a couple more reports in just the next 2 days from the same place, and then it almost just quieted down. And there were no more cases for an entire month. However, on the 2nd of March, there were 5 new reported cases of the coronavirus, again from Kerala. Since then, the cases have been on the rise and all the other states have been affected to some degree by this virus. In front of you is a brief timeline of the cases that have occurred in India so far. As you can see, the first case happened on the 30th of Jan. By the time it was 2nd of March, we had a total of 6 cases. In 2 more days, the cases went up to 32 and then to 50, 77, and currently we have crossed 550 cases. Now, this is the problem with a pandemic. Everything is fine until it's not. And because the rise of a pandemic is always exponential, we think of the problem as very minute till it reaches a significant stage, and then the increase is extremely quick. Now, there is a silly little riddle that you might have heard as a child about the germ and the slide. Or for some of you, it might also be the lily pad and the pond problem. But since I've heard it as the germ on the slide, I'm just going to put it up that way. So basically, the riddle goes like this. Now, there is a germ on the slide which has the property of replicating every day. So on day 1, if there's 1 germ, on day 2, there are 2. On day 3, there are 4, obviously. Now, in 60 days, the slide is completely covered. But when is the slide half covered? The answer is 59 days. But most of you already might know that. But have you ever wondered, when do the germs cover merely 1% of the slide? It would shock you to know that the day does not come until the 54th day, which means it goes from a mere 1% to 100% in less than 7 days. And this is called exponential growth. The growth of pandemics is kind of like this. It grows extremely fast once it's reached a significant point, and before that, it's almost unnoticeable. Now, this obviously can't go on forever. This virus cannot infect everybody because eventually it will stop finding people that it can infect. And hence, after a sharp uprise, the growth is going to slow down. Such a curve is known as a sigmoid. This is called logistic growth. And the curve you see in front of you is known as a sigmoid. Now, every point on the sigmoid is going to tell us the number of cases for a given day. But if you find out the slope at any given point of this sigmoid, it is going to show you how many new cases are there on a daily basis. And it makes a lot of sense, right? Right in the beginning, you don't have that many cases. Then suddenly you have a lot of cases for a given amount of time. And in the end, it all flattens out and cases reduce. And if you've taken calculus in your higher classes, you'd know that by taking the slopes of the curve, you're going to come up with something like this, which is what every government is worried about. This might overwhelm our healthcare system, which is the amount of resources that we have to save the number of people. All we have to do is flatten the curve so we can delay this entire process of the spread of the pandemic, and we can bring the curve of the spread of the disease below the resources line to cause minimum number of deaths. And the only way we can do that is by reducing community transmission, which brings me to my next cell. The recent COVID-19 cases in India and the Prime Minister's speech on the 24th of March. Now, most of you might be aware of this. Like a lot of countries, the Indian government declared a 3-week nationwide lockdown starting midnight Tuesday, explaining that it was the only way of breaking the COVID-19 infection cycle. The citizens were told to stay inside of their homes for 21 days to reduce the transfer of this virus. And the government also issued a notification that said all essential services will remain open and crucial commodities and medicines would be available. so as to stop people from panic buying and overcrowding shops at that one night. Banks, ATMs, petrol stations, hospitals, and grocery shops will continue to function. However, all transport services, air, rail, and roadways will be suspended until the 14th of April. Now, the next thing we're going to do is that we are going to be reading the data sets. Okay. So first we are going to read our Excel file and create a data frame using pandas. Remember, I had told you if it's got anything to do with tabular data, we are going to be using pandas. And if you have a doubt on where we have procured this data from, all of the data sets have been taken from the government official website, and the time series data sets have been scraped from Johns Hopkins University's updated Git. So what I'm going to do is I'm going to be reading the data sets and creating a data frame. All right. And now you have the name of the state, total confirmed cases of Indian nationals, total confirmed cases of foreign nationals, and people who have recovered, and death cases. Next, again, we are going to read another Excel sheet which has the Indian coordinates. Again, you can procure the latitude and longitude of all the cities. It has been recorded, put in a spreadsheet, and you can get it from the government official website. And by running the cell, what we're going to do is we're going to find out the daily progression of the cases in India as compared to the same in Italy, Korea, and Wuhan. Now, this module is divided into several subsections, and the first of them is focused on understanding where we are right now. What is the situation in our country and what is the situation globally right now? Yes. So currently, we have the total number of confirmed cases of Indian nationals and foreign nationals, and the number of cases of recoveries and deaths. Now what we are going to do is we are going to find out the total number of cases that have been confirmed with the Indian nationals and foreign nationals combined as statistic. So I'm just going to run this. Okay, so here you have the answer. The total number of confirmed cases in India as of 22nd March 2020 was 562 cases. And then finally, we are going to highlight our data frame using a gradient background, as you can see right here. All right. Now, what do we get to know? Obviously, you can realize that the darker the red is in each of these cells, the more the number of fatalities are. That is one thing. We can also see that Kerala has the largest number of confirmed cases with 109 cases, immediately followed by Maharashtra at 101 and Karnataka at 41. The least number of cases is in Chhattisgarh. We have Manipur and Mizoram and Puducherry with 1 case each. Kerala currently is at 109 cases. However, the number of deaths is still 0. The death count till now is at 9 people as of 25th of March 2020. Moving on. Now look at how easily we have gotten this. All we had to do for the total number of cases was to add all the total number of Indian national cases and the foreign national cases. All you have to do is name the data frame, which in my case is DF. Before this, we did not have an additive measure. Here, along with having an additive measure which gives you a total number of cases, we have also colored each cell according to the fatality rate. And it's honestly not that hard. It's just like one extra line in your code, and that is it. So next, what I'm interested in knowing is the number of cases that have been affected in different states and union territories. Like previously, in our previous table, you can see the total number of cases here, the total number of recoveries and deaths. But right now, what we want to do is we want to look at the number of cases of affected people in states and union territories. So we do not want to know the number of people that have passed away. We do not want to know the number of people that have recovered. We only want to know the number of people that have been hospitalized at the moment. So I'm going to subtract the total number of deaths and cured and only going to pick out the total number of active cases. And then we're going to obviously sum them all and print it separately. Okay, so right now we know that the total number of active cases, subtracting the total number of deaths and the total number of people that have recovered, currently we have 512 active cases in India. Further, what we did was we grouped the states and union territories and we sorted them by the value of their total active cases. So again, as you see, we have Kerala, Maharashtra, and Karnataka as our 1, 2, 3. And this df dot group by, this group by function is basically like your pivot function if you have ever worked with Excel or say Power BI. This is like your pivot function. It turns wide format tables to long format tables. And finally, we added the same gradient background because Kerala has the maximum number of cases. You can see it's a very, very deep red, immediately followed by Maharashtra. Then we have a couple of peaches. And in the end, we have Manipur, Mizoram, Chhattisgarh, and Puducherry, which are completely white. Now, basically, we're going to try to understand the data from a different standpoint. This time, maybe visualizing it over a geographical map. Now remember back in the first cell how we had imported a library known as Folium. Basically, we are going to use this particular library to populate a geographical map. Now, if you go down and read our data sets, we have a data set which has the Indian coordinates in an Excel sheet. It's right here. Basically, we are going to use this particular library and this particular data set, and we are going to populate it according to the number of cases, how densely affected is that particular state. Okay, so there's nothing much to do. We are going to use the Folium library. We're going to use folium.map, and we have specified our location, and we have zoomed into our geography. We've also entered latitude and longitude and the values of the number of affected cases in a particular state, which is currently in a zip file, into our data frame. And we are going to display it in the form of a circle marker whose size will depend on the number of cases in a particular state. So we have this map where you can see that Maharashtra has a really big circle, so does Kerala, and we have a couple of big circles in the North India as well. East is somehow less affected by this, as we had seen in our table before. Okay, let me just bring this here. Yeah, much better. Now, there are a couple of other ways as well to read into this situation. Remember how we had imported the Seaborn library? Here, basically, we are using Seaborn for visualization, where we are going to plot a couple of bar plots showing the total number of cases per state as well as the total number of cured cases. We are going to show the total number of cases in pink and the cured cases in green. So from this, you can see that Kerala is the highest number of cases, immediately followed by Karnataka. You can also deduce from this that Kerala, despite having the maximum number of cases, also has more amount of recoveries from Maharashtra, which brings us to a conclusion that the net percentage of affected people are actually lesser in Kerala than that of Maharashtra. And then you have Karnataka, Telangana, Uttar Pradesh seems to have cured quite a lot of people, and so has Haryana. But then their counts were also comparatively way lower than Kerala and Maharashtra. Now that we've understood where we are as a country in this entire pandemic, let's try and understand the trend of the rise of coronavirus. Again, to remind you, in the first cell of this particular model, we had also imported something known as Plotly, which I had said then is an advanced visualization library. Now we have gotten two graphs. Let me take the time to explain to you one by one what these graphs are. The first graph basically intends to show you the rise of COVID-19 cases in India. We are basically using a scatter plot, and we are using a line plus marker sort of a visualization, and we are also choosing the plot background color here. If you hover around this, you will get the date and the total number. And the best thing is if you can just zoom between, say, March 1st and March 8th, it will zoom into that part of the graph and you will get individual different plots for different days in the graph. Like we can see this quick switch between March 3 and March 4. In March 3, the number was 9, and March 4, it was 28. And if we zoom in even more, we can see the rise from 12 on the 3rd of March to 12 on the 4th of March. We can see it grow through 6 o'clock, 12 o'clock, and 6 o'clock in the evening, all the way up to 12 a.m. at night on the 4th of March. Now, the next one graph that we are creating reports the daily number of cases in India. We are going to use a simple bar chart where our axis is the date and our values are the new daily cases. And again, here too, we can select our plot color, which we have kept uniform with our previous plot. And here you have it. You have these two little cases in February, and then all the way no cases up till March, and then finally in March when we started getting more and more cases. And by the time it was the 22nd of March, we have reached a peak of 103 new cases on a particular day. Now this was all about India. The next section focuses on comparing the trends in India to Italy, South Korea, and Wuhan. Now let's find out how the trends in India are in comparison with Italy, South Korea, and Wuhan. So we are going to import a column graph using Plotly. And here we're going to plot the total number of cases, the cumulative cases against date, right? So we are going to do the same for Italy, Korea, and Wuhan. So let's go ahead and run this cell. Okay. So here are our visualizations. So first, I'm going to talk about India as well as Italy. Okay. So this is the graph for India. As you can see, it is an exponential graph, which has taken a hit since the 3rd and 4th of March, especially the 4th of March, which we had seen in the graph before. A very similar graph is that of Italy. If we just bring it a little lower, this is the graph for confirmed cases in Italy. And again, you can see a sharp exponential increase in this graph after the 3rd and 4th of March. But it is very even in Italy. You can't see any breaks or kinks in the graph, unlike India's. And as you can see, as of now, there are 69,000 cases in Italy right now. Now, this has happened because Italy took too much time to do what we are doing right now. If I can just bring back India's graph, right now we are at 562 cases. Our graph is scaled out because the number of cases is low, but you can see the pattern remains the same. We on our second stage, which is of community transmission, have already got into lockdown, which took Italy a lot of time to recognize the pattern and then go into a state of lockdown. We have already practiced quarantine on our second stage, which is why now, if you can see towards the end of the graph, it has actually started to flatten. The growth from March of 23rd to March of 25th hasn't been as steep as it is between March 22 and 23 and March 21 and 22, right? In Italy, the curve still hasn't started to flatten out even after 69,000 deaths. But let's talk about the two more interesting cases. First, let's talk about South Korea. Let me just bring in. As you can see, remember we had discussed the sigmoid graph, the sigmoid curve, which shows logistic growth in a certain parameter. South Korea has started to completely become a sigmoid curve since the 7th of March. And the reason is that since the beginning of March, South Korea had actually started extensive testing. Anybody with even the mildest infection has been quarantined in this country, which is why they have successfully flattened out the curve almost. If you look at the last 3 days, March 22 to March 24, the increase in cases have been very minimal. And finally, we have Wuhan, we have China. As you can see, there was a steep rise between 12th of Feb and 13th of Feb, and it went on rising. Again, this is also following a sigmoid pattern, but it has successfully started to flatten out after 66,000, 67,000 on the 3rd of March. Now, that is because China has started to adopt some artificial intelligence models which has helped them diagnose people with flu on a very extensive scale. I hope all of you must have heard about a company called Baidu's. Now, they have come up with heat mapping on human bodies in China. This is machine learning at its best, guys. What the system does is it picks out people with mild temperatures straight out of the roads and sends them directly into testing. And I cannot emphasize enough how important is testing in a case like this. If you have the mildest fever, if you have the mildest fatigue, I would recommend go to the doctor right away, because that is how these two countries have flattened their curve. That is how China and South Korea have led to reducing their daily cumulative COVID positive cases. Now, this radiographic detection of temperature, that is basically the technology through which China is picking out people for testing, has become their solution to facing this pandemic. And with a country as densely populated as China, they have a lot of data to work with. They have a lot of data to build upon and analyze and come up with treatments and solutions for their people, because the more densely populated your statistic is, the more reliable it becomes. Now, this also led to China selectively treating their patients, which is kind of a controversial topic. They use AI solutions to pick patients who have the highest probability of survival or who are most likely to survive, and they give them the priority in treatment. So that leaves out a lot of people who are above the age of 70 and people who are already bronchitis patients, who have weak lungs, so on and so forth, which is why it is a very controversial decision by the government of China. But that brings up their recovery stats, and that is their decision to follow. But that's about China. Talking about India, if we have to flatten our curve, like I said, we have to test, and we have to stop this infection from spreading as extensively as it is, as rapidly as it is. Now, when we talk about pandemics, the number of people that are going to be affected varies very little. But what we can do is we can slow down the progression in which we reach this number. So at any given point of time, our curve of affected people is closer to the amount of resources we have as a country, in which case the number of affected people will remain the same, but the recovery rate will shoot up rapidly. So closing words from this section is that I am thoroughly in favor of radiographic detection of temperature, which is being used in China. It can not just help a country during this pandemic, but also in many others in the future. As a result, we have recent updates from Wuhan, which suggest that this Tuesday, China decided to lift the 3-month lockdown in the central Hubei province, which was on more than 56 million people, as the bus services began in Wuhan for the first time since the 23rd of January. at 5:25 a.m. on Wednesday. And due to the massive improvement in their numbers, they are finally lifting the mass quarantine on Hubei's capital, Wuhan, on a population of over 11 million people. Moving on, now the comparison we did previously could be done in a common graph as well. So here we are using Plotly again to strike a comparison between all of those countries, Wuhan, South Korea, Italy, and India, and bringing them onto one canvas. Here, as you can see, the legend is given on the right. The more number of cumulative cases per day, the bluer your graph becomes. So we have South Korea and Italy up top, and we have India here at the bottom. You can see all the graphs that you saw before, but here you can see them on one canvas. We have the same numbers. We have India at 562. We have Italy at 69,000. We have South Korea at 9,000. And from a comparison point of view, I think this sort of a visualization obviously contributes more than the previous one, because we don't have to scroll up and down and look at each graph individually. We can just look at all of them at the same time. And this is as interactive as your other Plotly graphs have been. So you can zoom into these graphs like so, and zoom out by double clicking on them. Now, as we had looked at the numbers before, currently South Korea is at 9,000, Italy is at 69,000, and India is at only 562. But why is India's statistic so low compared to countries which are much smaller and much sparsely populated than ours? Is it because we have such few cases, or is the reason something else? Let's find out about that in the next section. So here we are going to start looking at the trends of countries after crossing 100 cases. Now, as we all know, the case in China, the progression happened really, really quickly without having a systematic method of recording the progression. So we are not using the data for Wuhan. We are simply going to use the data for South Korea, Italy, and India. So for this particular trend, we are going to go ahead and add this column, which brings up the values for the days after surpassing 100 cases in each of these countries. We have this for Korea, we have this for Italy, and we have this for India as well. So let's run this cell and see. Okay, so now we have this graph. This bold blue line represents India, and then you have South Korea, this green line, and the red line is Italy. So as it shows in the graph, India is actually doing a much better job than Italy and South Korea when it comes to the spread of this pandemic. This graph depicts that in the number of days after the COVID-19 cases has crossed 100, India has the minimum number of cases out of all the three countries. Both Italy and South Korea have crossed the mark of 5,600 in the next 13 days. But is that the actual case? Are we talking about the total number of cases, or is it just the total number of reported cases? This brings me to the next section, where we are going to discuss the theories behind India having such low numbers when it comes to this pandemic. This is a news article I pulled off of the CNN website, and it discusses the fact that India is not testing enough to find out whether the total number of recorded cases is the actual total number of recorded cases or just the reported number of recorded cases. It is headlined very controversially as "Why is a densely populated country with more than 1 billion people testing so little?" Now, one of the theories by experts is that India is testing below scale because of being under-resourced and an uneven public health system, which could be swamped by patients. This further states that India could be buying up time to stock up on testing kits and add isolation and hospital beds. But the official assumption is that the disease has not spread in the community, as early evidence health authorities say 826 samples collected from patients suffering from acute respiratory diseases from 50 government hospitals across India between the 1st and 15th of March tested negative for coronavirus. Additionally, they also state that it's kind of reassuring that at the moment there is no evidence of community outbreak, as a huge spike in the growth of coronavirus in India would do nothing more than create more fear, more paranoia, and more hype on the disease. But this is the case of our resources. According to the data in our government websites, India has 8 doctors per 10,000 people compared to larger numbers in Italy and Korea. The medical resources are bleak, and the poor culture of testing and people not going to doctors can lead to a sudden paranoia, which the government is trying to prevent at the time being. But this is just a theory. I am just presenting two sides of the same report. If you want to read the same report, we are going to link this model in the description box below. You can click on this link and it's going to open up the report I pulled this snipping from. All right. Now that we've spoken about India, compared it to Italy and Wuhan and South Korea, let's move on and explore worldwide data. So now what we are going to do, we are going to import and explore the impact of this pandemic on the world. For that, we are using 3 separate time series spreadsheets, which you can acquire through the GitHub repository uploaded by Johns Hopkins University, or you could just go down and get it from the link I'm going to leave in the description box below. So we are basically going to read 3 CSV files. One is the confirmed number of cases. The second is the recovered global cases. And the final one is the number of deaths. Here we are doing nothing, but we are just reading the 3 CSV files. And here we are basically renaming columns. And what a head or a tail function does is it's basically going to show you the head or the top 5 results of a certain table. If I would have put tail instead, it would show you bottom 5. It's no big deal. So let's just enter this. Yes, and this is what our table looks like. We have the province or state, we have the country, latitude and longitude, and this is the entire data by date. Now, as I had mentioned earlier, this is okay for reading purposes if we have a wide format data, but to be able to effectively analyze the data, we need to convert it into a long format. If you remember, I had mentioned earlier, the group by command in Python is like the pivot functionality if you use any other spreadsheet software like Power BI or MS Excel. So we're just going to convert this wide style format into a long format. So here you have it. You have condensed the date into one column instead of multiple columns. Now you have country, you have province, you have confirmed deaths and recovered from the 3 spreadsheets that we were reading earlier. And because we have the entire world's data, we can obviously go ahead and check for India's data, which is what we are doing here. We are querying for India's data and then we are pivoting the table into a way that is more desirable for us. Now here we are. We have our date brackets from 22nd of January to 26th, which is our top 5 dates. Here we have our confirmed cases, deaths, and recovered. As we had discussed earlier, the entire month we did not have our cases until March when it shot up in India. And then we have our latest 5 dates where we have some sort of confirmation. We have 19th through 23rd. And you can see the confirmed cases, the deaths, and the recoveries. Now we basically want to display the overall worldwide confirmed cases, deaths, as well as recovery cases. And this is it. This table gives you the head, which, as I said, top 5 dates, or the first 5 dates, the latitude, longitude, confirmed number of cases, deaths, and recoveries. Now let's visualize this thing. So what we're going to do is first reset the indexes of all the 3 data frames that we are using. And we are going to plot date-wise confirmed cases using the Go scatter graphs. Here again, we are going to be using lines with markers. And you might remember this pattern of the graph from the cumulative graphs that we had seen before. The blue line shows the total number of confirmed cases, the green line shows the number of recoveries, and the red line shows the number of deaths due to the coronavirus. Now, as a data scientist or somebody that creates machine learning models, this is one of the things you can either take advantage of, or this is something which you have to do. But the fact of the matter is that you have to pick the correct visualization, which is going to give proper representation to the insight you want to deliver from the data that is given to you. There could be a number of ways to represent a certain piece of data, but you have to decide which are the parts you want to highlight out of that data and which are the parts you do not want to show, which is not important for your audience to see. There are always a couple of ways in which you can deliver an insight that you have drawn from certain numbers. And that is just part and parcel of what comes with being in data science. So as you can see, here there is a dip in Feb 12 and a sudden rise in Feb 13. As a data scientist, these dips and spikes in a perfect curve should make you curious about what happened on that particular day that made this curve askew, or why did the curve go out of the way of being a perfect graph? Now, I did some research on this. The reason there is this kink in this part of the curve is that on the 12th of February, the main body which is responsible for researching about coronavirus came up with a new method of counting patients that have been affected by COVID-19. So on the 13th of February, there was a massive increase in the daily number of cases of people affected by the virus. But then by the end of the day, they realized that was not the proper method of counting the number of fatalities or the number of patients, and hence they switched back to the original method, which is why the graph is smooth then on. But due to the changed method in counting, the cumulative graph is obviously affected, and hence it skews from being the perfect exponential graph that it had set out to be. Now that we have learnt about India, we have learnt about India in comparison with Italy, South Korea, and Wuhan, and we have also explored through a worldwide data set, let's move on to the final part, and honestly, the part I look forward to most in this particular model, which is the forecasting and prediction section. Now, for this, we are going to use an open source software called Prophet, which is actually developed and released by Facebook's core data science team. Now, if you want to download it for R or Python, you can easily do so using CRAN or PyPy. We basically use Prophet for forecasting time series based data on an additive model where nonlinear trends are fit with yearly, weekly, and daily seasonality. Now, in my experience, it actually works best with time series that have a really good seasonality to them. But that's the case with any forecasting package that you have. Now, the great part about Prophet is that it is robust to missing data and shifts in the trend, and typically really handles outliers in the graph really, really well. For how fast it is in predicting and forecasting, it can be extremely accurate at times. Despite being fully automatic, it is also tunable. And obviously, as I had mentioned before, it is available for both R or Python. For R, you can download it from CRAN, and for Python, you can download it from PyPy. Now, here are a few GitHub references for this part of the code. So let's go ahead and do some forecasting. Well, isn't that what all of you all are here for? So we are first going to start out by importing Prophet into our RAM. Then we are also going to pivot our data frames as we had done earlier. Now basically, when we are using Prophet, we only need to give in two inputs, which are like two columns. The DS is the date stamp column, ideally in the format of year, month, and date, or year, month, date, and then hour, minute, second, sort of a format. And the Y column is the values column, which must be a numeric measurement, which needs to be a numeric measurement which we wish to forecast. So now that we've done that, here, the two columns are DS and Y, date stamp and values. And this is for the confirmed data set that we have. So let's run this. And we have also chosen to show the tail of that data set. So we are getting the bottom 5 values. We are getting values of March 19 through 23rd. And this is the value that we have as of now. Now what we want to do is that we want to generate a forecast for a week ahead of confirmed cases of this new coronavirus using Prophet. Now, most of you might wonder what this interval width is. If you've taken AP statistics in high school or college, you would know that interval width is actually confidence. This is either given by decimal or it can be represented in percentage. What 0.95 or 95% actually means that there is still scope for 5% error or 0.05 error, which means we are 95% sure that our forecast will be correct. So this is basically we are fitting our graph into our view and we are doing a forecast for a period of 7 days. And again, we are going to show the tail of the table because we need the latest values or the values at the bottom. And here we have it. We have our timestamps from 26th of March to the 30th of March. This method is basically assigning a predicted value in the future to a row, which it names as y hat. If you're going to pass previous dates or historical dates, it's going to provide you with an in-sample fit. The object of forecast here is basically a new data frame, which includes the column y hat with a forecast as well as the columns for components and uncertainty intervals. As we had said, we are only 95% sure that this is going to be the correct forecast. And if you look up, we have been given an info about disabling our yearly seasonality. And yes, because coronavirus does not have any seasonality. Hence, we have put in no seasonality in this forecast whatsoever. Next, we are basically trying to find out a range within which the prediction is going to occur. Yes, we have predicted numbers, but it obviously can't be right on spot every single time. So we are going to try to put it within a range with an upper limit and lower limit. So at least the value does not deflect so much that it's basically we are setting up a tolerance for our forecast. So here you can see the value that has been predicted, which is y hat. Here is the lower limit, which we are predicting as low as the number can go. And here is an upper limit, which means it's only as high as the number can go. The tolerance lies between y hat lower and y hat upper. Now we are going to plot this forecast by calling the profit.plot method. We're going to pass it our forecast future data frame. And this is our graph. As you can see, it goes beyond 24th. And this is the week zoomed in. We have Sunday through Saturday, knowing that our number is going to start real high. Now you can see there's a huge dip in Wednesday. And that makes a lot of sense because there was a huge dip in the number of cases in China that particular day, which, as we all have realized through the model that we've been creating, has been a huge contributor to populating the affected crowd. And then it has grown up naturally. Now, another thing happened that Tuesday, which was the Janta curfew or the lockdown on the 22nd of March. Why do you think it was? Our Prime Minister announced a Janta curfew on Sunday, and from the 24th of March, there was a complete lockdown in the entire country. There was going to be no scheduled international commercial travel, and all the international flights had been called off. Luckily, all of that was for our own good, and it has greatly contributed to curb the situation of this virus in our country. But what do you guys think? Leave your answers in the comment section below, and we'd be happy to reply to you. Now, moving on, let's try and forecast the worldwide deaths using the same base model. Again, this is the predicted number. This is the predicted value. And this is the upper and lower tolerance. And if we plot this, the black dots are the original values and the blue line is the forecast value as you had seen before with the upper and lower tolerance. As you can see, in the beginning it is coinciding with each other, but after the spike, the numbers have skewed a little bit, but they still fall under the tolerance. Now, according to this forecast, the number of deaths again come down from Tuesday through Thursday, and that is obviously because the number of confirmed cases is predicted to come down between those 3 days. So at least one thing we can take away from this is that all of these graphs are consistent with each other. And now finally, the recovered cases. So I'm going to do the same thing. I'm going to run all of these cells and they're going to come up with date stamps. And again, we have quite a recovery out there. And this, out of everything, has the most coinciding graph, as we can see. Like even in the exponential increase of the predicted cases and actual cases, there is amazing cohesiveness. And as you can see, the recovery cases are most in Sunday and Monday, obviously because most number of identified cases according to our model are also on Sunday and Monday. Tuesday, Wednesday, and Thursday, right till Friday, take a hit because obviously there are no cases between these 3 days. So who are doctors going to recover for these 3 days? Friday, it has hit rock bottom and it rises on Saturday again. Now moving on to answer the most important question which we had set out to find the answer to through this entire exercise. Will India become the next Italy, South Korea, or Wuhan? The answer according to this model is yes, most certainly. If you look at the world's data and its forecast, you can say that our country might face one of its worst days unless and until we do something which quickly and strictly curbs the spread of this disease. This lockdown is just one of those many steps that we could take as a country. The pattern of rise of the spread of virus is exactly mimicking how it went up in Italy and South Korea. So a short request to all of you is that the moment you figure out symptoms in yourself, go ahead and test. Do not take your cough and cold lightly. This could be absolutely fatal to your health, especially if you are late middle aged or you know somebody who is an elderly person. Take them immediately to your nearest doctor or nursing home. You can already look at the number of cases rising in other parts of the world. So please take a lesson from there. We still are in the second stage of progression of this pandemic. We can still curb its spread. And if not curb, we can at least slow it down by taking care of ourselves and the people around us. Remember, the reason the number of cases in India are lower than these other countries is partly because the low number of reported cases in our country. Currently, we are an exponential contributor to the affected population of the world as well. Yes, the fatality has been predicted to be only 2% of the affected crowd, but the forecasted crowd to be affected by COVID-19 is said to be around 60% of the world's entire population, which means the 2% that we are taking so lightly is nearly 8 crore people. The Indian government's decision certainly confirms that there is something to worry about. So please stay indoors till the government asks you to do otherwise. This will definitely help curb the situation. It won't definitely stop the pandemic, but as I said, we can slow it down and hence reduce the number of deaths caused by this pandemic. Go and get a checkup if you're suffering from cough, cold, fever, or any discomfort in your lung. Take precautions, stay indoors, sanitize everything around you, and take this pandemic seriously. I shall leave you with that thought. My name is Upasna. Thank you and have a great day.